Hi, my name is Ella Nuallain and I'm a healthcare consultant based in Sydney, Australia. So I guess today is really exciting because it allows us to take a step back and kind of reframe COVID-19 and think about the opportunities that have come out of it over the last year and a half that we can take forward into the future. So the 5 ideas I'm going to touch on are: number 1, capitalising on health tech advances; 2, easing the cognitive burden for frontline workers; 3, employing health prevention strategies across the wider population; 4, continuing an increased focus on supporting our vulnerable populations; and 5, promoting the public-private balance. So the first one I'm going to explore in a little bit of detail is looking at our health tech advances. So we've seen how technology has essentially enabled us to continue to function as a society over the last year, where many things could no longer happen face to face. In healthcare, telehealth has been absolutely fantastic to allow clinicians to engage with their patients and to continue to perform consultations while patients may not have been able to actually access the hospital or their GP. Obviously, this has amazing kind of benefits over the longer term when we look at actually allowing telehealth to help us to access more rural populations and a wider group of people where they're not maybe able to come into the practice or the hospital as easily. We also need to be cognizant of the fact that we need really good networks, so phone networks, to support this kind of care. So it also looks at the importance of establishing good kind of connections and broadband across the country, particularly in the kind of harder to reach areas. Also with telehealth, it does have its caveats and shouldn't be just deployed everywhere. It only works for a certain type of healthcare, and it also only works for a certain type of patient. So it's not very useful with maybe an elderly population, or here in Australia there's many Indigenous populations or communities don't really use telephones, don't really use the standard kind of Western clock. So things like dialing in for a certain time isn't really appropriate. So we have to just be cognizant that we're using it in an appropriate way. Another kind of tech advance that we can look at is remote monitoring. So this is an exciting prospect in that it will allow us to discharge patients quicker to their homes into the future, where they can be monitored through wearable technology or inputting data into mobile apps. Studies show that patients really recover better in familiar environments such as their own homes, and this in turn frees up bed capacity in the hospitals. Another really exciting tech advance that we will see coming more over the future years are haptic technologies. So this is like an AI doctor. So it's where kind of a robot essentially has the touch and feel of a human doctor, and they're able to operate on a patient controlled by a clinician from millions of miles away. So Deakin University in Australia is developing this technology at the moment across some other industries as well. And as far as I'm aware, it is still undergoing trials, but it's a really exciting change that could happen that could really change the way healthcare is delivered into the future. Another health tech advance is the use of predictive analytics. So this allows us to analyse huge data sets that help to inform decision making for clinicians. So they're not just making the decisions based on their own experience and study, but on a much wider set of data that's at their disposal. Additionally, it actually allows you to look at, maybe it might set a trigger for a clinician where they might get a blood result in one area, and that trigger indicates that they should look for signs and symptoms of something else. Where I've seen this work really well in the last year is this kind of predictive analytics is with the NHS Capacity Tracker app. So this looks at kind of demand and capacity planning, and it was developed predominantly to react to COVID outbreaks in nursing homes. So really it was allowing us to understand where they were kind of, from the hospital perspective, where to discharge patients to based on kind of number of beds, staff who were available if staff had to take leave for contracting the virus, PPE levels if they had adequate amounts. So it just really helps kind of nursing homes and hospitals to have that line of communication and line of sight for better discharge. So then the next one I'm going to look at is easing the cognitive burden for frontline workers. So while we've looked at how health tech advances can be hugely helpful, we need to make sure that they are user-friendly. We tend to find that hospitals and practices have outdated systems, which really increase the cognitive burden and increase that mental load. So we need to make sure that kind of the systems that the general public are used to using in their homes, such as apps on their phone or Zoom, that those things are actually used then in the workplace as well, so that they're not having to think about how to use a certain technology, but it's almost second nature to them, which in turn frees up kind of brain space to focus on the medical needs of the patients in front of them. Another thing we can do to ease the cognitive burden for frontline workers is to ensure that we're fostering safe working environments for them. So this means having adequate levels of PPE, and it also means having proper security. So if patients become a little bit violent, that they know they don't have to worry about that because there's someone there to protect them, and it's not an additional fear. And we know that over the last year, it's been a hugely scary environment for our frontline clinicians who have been working in the environment of COVID-19, particularly before the vaccine was brought in. So I guess it's really important to recognise that they have had that increased cognitive burden for quite a while, and to rectify this over the kind of shorter and more medium to long term. Mental health programs and staff well-being programs should be implemented that really are kind of iterated as they're needed, making sure they're still useful as the situation changes in hospitals, and that they do have that kind of medium to longer term focus where we are really focusing on supporting the workers who've done so much for us over the last 18 months. The next one I'm going to look at is employing health prevention strategies. So really, I guess this is about engaging the population in their own health. So we've seen over the last year or 18 months with COVID-19 how the benefit of signage and health promotion programs and marketing about washing your hands, wearing masks, social distancing, it's really helped to improve health literacy in the general public. This can also be done with things like exercise and diet, which will allow us to see wider impacts over the longer term as people have a better awareness of what will keep them safe and healthy. Another kind of health prevention measure we could put in place is really lobbying for legislation for signage on food products. So this makes sure that everyone kind of is aware from a nutritional or dietetic standpoint kind of what food is good for them. Rather than just going for the cheapest option, they have a little bit more, it gives people a little bit better kind of, I guess, buyer decision making. It empowers the buyer if they have access to something that's very easy, such as like sugar cubes on packets, to show what's kind of better. Here in Australia, they use a health star rating, so it's from 1 to 5, so you'll see products like Weetabix with a 5 in health, and then products maybe like your jellies or your chocolate, which might be closer to a 1. So it just allows you to think when you're actually going to buy food, is this going to be healthy for me? And it really, it's about empowering the buyer while also incentivizing food producers to create healthier products. The third health prevention strategy I'll talk about is social prescribing. So this is something where you kind of, a clinician or a clinician might prescribe kind of therapies or exercise for patients. So they may actually prescribe them to a certain place that does it. So for example, I actually work with an organisation here called Mood Active, and Mood Active conducts exercise programs for people who are experiencing depression, anxiety, bipolar disorder, and it's really about kind of engaging them in exercise, helping them to step through that and seeing the benefit of it over a short term, and then trying to build habits towards a longer term. So I've really seen Frontline, I teach a bar class once a week, and I've seen firsthand, I guess, how important this is for people and how much of an impact it has on sustaining a healthy mindset. And the next one I'm going to focus on is continuing the focus on supporting our vulnerable population. So we've stayed at home to protect older and immunocompromised populations, and to protect really those who are more susceptible from negative outcomes from contracting the virus. Peter McVerry have a fantastic Housing First programme, which is essentially to help people who are experiencing homelessness to move into housing, which has really come out of increased funding since COVID-19 erupted. New South Wales Homelessness has done something similar here. We know that communal living is really poor for spread of disease, not just COVID-19, but many diseases. So moving people into better accommodation is often the first step in improving their healthcare. We can also do things like reserving the single-use vaccine for these kind of harder to reach groups, which may not be able to calculate their time between injections and may not be able to get them a double time. We've also seen an increase on supporting people experiencing domestic violence, and here in Australia on the Indigenous communities. And these things need to be continued into the future. And the last thing I'll touch on is the promotion of the public-private balance. So to optimise the accessibility and equity of access to healthcare, there's a bit of a need to encourage those with the means to pay, which in turn then frees up waiting lists in the public system. The private sector is also an appealing partner because it's able to bring innovation that the public sector really, I guess, can't bring in the short term, and it offers improved efficiencies. And then with partnerships between both, it can kind of offer the long-term cost savings, the achievement of quality benchmarks, and kind of the public sector can then benefit on economies of scale. It is also very important to make sure that it's about collaboration and not competition between the two. And also looking at how we can kind of provide health services in the non-traditional settings, such as workplaces, pharmacies, shops. We've seen Brewdog in the UK is now a vaccination centre, which I think is a brewery. So there's some really exciting options out there if we look more about how we can support the public sector through private health initiatives as well, and healthcare organisations. So to reiterate, my 5 points are: capitalise on health tech advances, ease the cognitive burden for frontline workers, employ health prevention strategies across the wider population, continue the increased focus on supporting vulnerable populations, and promoting the private-public balance. So I'm really excited to hear what further ideas are sparked amongst everyone else shortly. Thank you.